my God, I can't believe I had to inject myself for the rest of my life. What's the alternative? If one injection every 2 weeks could make me feel like I on top of the world again, brain fog gone, mental clarity, you could get up and do everything that you need to do. You're not getting any muscle pain, you're not sweating excessively, so you're keeping most of the hydration in your system. You're basically feeling like you used to feel when you were a teenager. So in my last B12 update, I was feeling like absolute crap. It was taking me 4 to 5 takes just to get one sentence out on video. But I had an appointment with my doctor that same afternoon. That kind of changed everything. During that appointment, we started looking at some of the blood work I did during the 4 to 5 months I started the B12 regime with my doctor. And there is where we started connecting all the dots. My doctor started noticing on my blood values what I have been experiencing for years. Around the second week after getting the B12 shot, my values will drop by about 200 points. After the third week, it will drop even more. Now, even though my B12 was technically in a good range, which is 600, the drastic drop from the high 700s to the 600 within a week's time is cause for concern. That combined with all the other symptoms that I was getting, the brain fog, lethargic, sweating, and overall just feeling mentally and physically drained. That made it clear that even though we were putting the B12 into my system intravenously this time, for some reason or not, it wasn't staying long enough to get absorbed into my cells, my brain, and my muscles. So the next question is, what is the solution? More testing, of course, right? We had to figure out why it not getting to where it need to go. So basically right now, I need to schedule an intrinsic factor test. That is just a blood test. So basically what we want to do is draw some blood and check the intrinsic factor to make sure that I have that sufficient amount of protein carrier in my stomach to carry the B12 to the lower intestine for absorption. If that's the problem, then we stop right there. No more testing, and we find a B12 regime that's working for me. If that is not the problem, then we need to do a little more testing. And when I say more testing, that means we're actually moving away from the blood testing part of it and going to check stool samples. And basically what we're looking for in these stool sample tests is to find out if I have pernicious anemia. To see if I have anemia or if I have something like Crohn's disease that blocking or causing a malabsorption. So when the B12 reaches down there, it's not getting absorbed properly. Now here's the thing, right? Whether it is either the intrinsic factor, Crohn's disease, anemia, whatever it is, it's basically irreversible. Have no going back. There's no one and done fix. Not a surgery, not any medication that you could take. So even before the test come back, because we know there's no reversing it, my doctor made the call to start setting me up on a B12 regime intravenously. Because after 4 months of both treating the B12 and testing my blood meticulously, the conclusion is clear. This is the new normal for me. My life going forward, I'll need to be on B12 injections as a norm. So basically what we're doing, we're going back to the once every 2 weeks. So one shot every 2 weeks, but this time, because I'm going to be on this for the rest of my life, basically, I have to start self-administering my shots. That is not a problem when it comes to taking the needle part of it, because after 4 years of chemotherapy, I basically get accustomed to needle. The part that I'm not accustomed to is self-administering injections. That is one of the many reasons why I never get into steroids. The fear of injecting myself. Sometimes I don't realize how blessed and lucky I am, even though it has come and slapped me in my face. So here it is. I basically have no problem with either getting somebody to administer the shot or getting somebody to teach me how to do the shot myself. My neighbor across the road is a certified registered phlebotomist. She basically used to work in our lab, running bloods, administering blood tests, the full works. And my neighbor next door, who is actually my cousin, is on her 4th and final year of med school. I have basically the best guidance I could ask for when it comes to doing this thing. It basically unfuckable. It's up to me to mess it up in whatever way I do to mess it up in. Right? Today is Wednesday. the day that I record in this video right now, and tomorrow will be Thursday, and that will make it exactly 1 week since I get my last shot. And to be honest with you, I literally feel on top of the world right now. You could probably tell by the difference in the way I'm talking in this video from the last one. Everything going down in one take right now. I didn't even have to make a second take since this video started. But according to how everything went in the past, I am expecting that drop next week, closer to Thursday. So around Tuesday, Wednesday, I will start to feel that drop. But I want to try to push the injections for every 2 weeks instead of every 10 days. Because I want to try and see the less frequent times I could take the injection. Twice a month is best. So if we could get it to that, that would be perfect. And to be very honest with you, I know a lot of people might find themselves in this situation, right? Like a lot of people who have to go on TRT, a lot of people who probably in the same situation as me, who had to go on B12 injections for the rest of their life, and they're probably thinking, oh my God, I can't believe I had to inject myself for the rest of my life. But let me tell you something. What's the alternative? If one injection every 2 weeks could make me feel like I'm on top of the world again, brain fog gone, mental clarity, you could get up and do everything that you need to do. You're not getting any muscle pain. You're not sweating excessively, so you're keeping most of the hydration in your system. You're basically feeling like you used to feel when you were a teenager. So if I could get this from one injection twice for the month, I have basically no complaints whatsoever. I don't mind doing it. And you shouldn't mind doing it either. Because you had to remember, like I said previously in this video, this is my new normal. You don't have to fit in with everybody in every way, in the sense that you had to feel some type of way because you had to do something like this. This is just you, dog. What you pass through in life, like me, or if you have some history of a B12 deficiency or testosterone deficiency or something like that, what you pass through in your life, the people you trying to fit in and look normal around, and feeling self-conscious about taking that needle every 2 weeks or every week or whatever you have to do, that is bullshit. That is basically measuring yourself up to people who could never understand what you have been through. And that is a dotish thing to do. So stop being stupid. Take your medication, get your blood test done, figure out what's going on in your life that you need to fix with your health, and do the correct things. I mean, I literally feeling like I used to feel before I had cancer when I was a teenager. I literally feel like I could go back and start training today, but my doctor don't want me to start training so fast. I basically had to figure out how long this B12 stayed in my system without me trying to deplete it as fast as I could. So I need to work with him for now, and as soon as I could start training, once I feeling like this, what? I could be King Kong, dog. So this is just an update. I have the prescription here, right? I'll show you the edited version because I don't want to show you all the information on it. Basically, this week I'm going to pick up all them stuff. The vial of B12, the syringes, the needles, whatever. And next week, Thursday, I'll be taking my first self-administered shot. But more than likely, I will either have my neighbor across the road or my cousin next door to me helping me with that. But until then, it's Mangdal. Take care of your health, take care of yourself. Do something good today for somebody. Later.